Remember, whenever your patient's blood pressure is low, think tank, pump, and pipes. If your patient's blood pressure is tanking, don't panic. Let's talk about it. Here are some common causes of hypotension in patients that I would teach you if I were your ICU preceptor. Number one is hypovolemia. Whether this is from fluid loss or blood loss, hypovolemia can present as hypotension. Maybe your patient's dehydrated, maybe your patient's bleeding, maybe your patient is getting over diuresed. Besides the low blood pressure, your patient may be tachycardic, they may have low urine output, they may have dry mucous membranes, and they may have a low CBP. Number two is pump failure, aka something going on with the heart where it is not pumping efficiently to get that patient's blood pressure up. Think cardiogenic shock. The heart is unable to squeeze to keep that patient's blood pressure up. Whether this is from an MI, heart failure, your patient has some known cardiac history, patient may present with an elevated CBP, maybe you're hearing some crackles in their chest, they appear to be fluid overloaded, however, their blood pressure is low. Next is our distributive shock patients, your anaphylaxis, your sepsis. Your patient's blood vessels are dilated, dropping that systemic vascular resistance. They may have a widening pulse pressure. Your patient may also be hypotensive from obstructive shock. Think your PEs, your tension pneumos, and your tamponades. Look for your jugular vein distension, your muffled heart sounds, and for your tension pneumos, that tracheal deviation. Sometimes hypotension is also medication induced. Maybe your patient just took too many of their blood pressure medications, or we don't have the right cocktail of their blood pressure meds, so we end up dropping it a little too low. Or maybe your patient is intubated and they're on a propofol drip and the propofol is dropping their blood pressure. Neurogenic shock can also cause hypotension. Maybe they have a spinal cord injury and they've lost that sympathetic tone. A lot of times in these patients, you'll see bradycardia and hypotension, which leads you to think, there's some sort of neurogenic shock going on. And the last thing is your adrenal insufficiency in your low cortisol patients. Have you ever noticed that a lot of times in your patients with hypotension, we check their thyroid levels and we also check a random cortisol? This is because your cortisol levels and your thyroid levels can play a big role in your patient's blood pressure. Remember, whenever your patient's blood pressure is low, think tank, pump, and pipes.